For joining me this Sunday afternoon. Welcome from wherever you are in the world. Today, good to be with you. I'm your hostess, Dr. Sylvia. I'm a general practitioner and health educator with Askawayhealth. My interest is in women's health and sexual and reproductive health especially, but I do like to talk about anything and everything that's medical. So if this is the first time you're coming across my channel and our stream, I'm so pleased to have you here. On this channel, we have videos discussing trending medical, health, wellness, and lifestyle topics to educate and help us get the most out of our lives, no matter how busy we might be. We also publish a new video every Thursday afternoon, and our Sunday live streams are usually just an opportunity to catch up with the community, share some thoughts about some important medical topic or the other, take any questions that you come up with. So if you can make it a date, I'd love for you to join me. You can find us on social media on Askawayhealth, and our website is askawayhealth.org, and of course here on our YouTube channel. So you will find all the links to our platforms in the description box below. Make sure you find a way to connect or subscribe if you haven't done so already. And while we are on the topic of subscribe, I just want to say a big shout out and thank you to our new subscribers in the last week. Thank you so much for joining the Askawayhealth community. So good to have you guys on board. You inspire us to continue making more videos and getting loads of questions, answering them, getting people to interact and engage with the work we're doing is really encouraging. So thank you so much for that. Okay, so we have been talking about pregnancy stories for a while. This is our fourth stream on the topic. Why bring it up? Why did I bring up this topic? Why did I feel it was so important? It's to address the concern about whether or not we're glossing over how women could develop serious problems in pregnancy or childbirth. And it all started a couple of weeks ago when a Twitter thread went viral. A lady shared her own personal experience where she had quite a few different issues around childbirth, and so many other ladies came on the thread, to her Twitter feed to report similar concerns. And one of the most common issues that were raised was, I didn't know about this. Nobody ever told me to expect this. And so I thought that it was useful to provide some information to women who are pregnant or who have just delivered about some of these common or not so common issues that might develop and what to expect, and also give an opportunity for people to ask questions. So this week we're looking at smelly vaginal discharge in pregnancy, how to deal with it, what it looks like, what it could be. I thought this was an important one to look at this week. And I'm using some new streaming software. So let me know what you think about our feed this afternoon. Let me know if there are any audio or visual issues. If you like the new look, make sure you let me know in the chat, in the descriptions. That would be fantastic. Thank you. So hi to everyone joining in. Thank you so much. You guys say hello, drop comments. I know who's on the chat. We've got a few people logged on as well. That's fantastic. Thank you. So let's dive into the topic today. I thought we would start by looking at, what kind of vaginal discharge to expect in pregnancy, and is it abnormal or normal to have a vaginal discharge that's smelly, and then what causes the ones that are smelly, what makes them abnormal, and then how do we round up with that. So let's get into the first category. A bit of background first about vaginal discharge. Every woman gets a discharge from her vagina. Usually might start a year, few months just before puberty, and it continues until menopause. And the discharge is produced by the cells of the vagina, primarily to help keep it clean. And a healthy vaginal discharge is usually thin in consistency, clear, milky white color, and it shouldn't smell unpleasant. Your vagina, and an individual woman's vagina, will have an odor, and the odor will depend on so many different things, but as long as it's not unpleasant, that's your natural scent, and you don't have to do anything. We certainly don't recommend using vaginal washes or what they call douches. Introducing those can increase the risk of problems, irritation in the vagina, or even infections as well. So your own vagina has its own odor, and as long as it is not unpleasant or offensive, that's your natural scent, and it varies from woman to woman. Now, what a vaginal discharge, or what the vaginal discharge feels and looks like, can be a little bit different depending on where we are as women in our cycle. So during your period, after your period, you might find that the discharge is slightly different, and different during both halves of your cycle, of the menstrual cycle. So the half before ovulation and half after ovulation. Your discharge will be different when you get pregnant, and your discharge can be different if there's something causing an increased activity or irritation of those cells that produce the vaginal fluid and make up contributes to the things that make up the vaginal discharge. So that's a little bit of a background about the vaginal discharge. So what type of discharge should you expect in pregnancy? So very, very broadly, it is normal to have a discharge when you're pregnant. So that follows on from what we're saying, that a vaginal discharge is normal in every woman, and it is normal to have a discharge when you're pregnant. And the type of discharge you have when you're pregnant is generally heavier than before you got pregnant. And mainly it's simply to help prevent infection traveling up from the vagina into the womb. The discharge does get even heavier as you progress, as you go towards the end of your pregnancy. And in the last week, some women might experience, in addition to what is the sort of milky white discharge or clear whitish discharge, they might have a pinky tinge or jelly-like feel to the discharge, which is called show. And it's simply because the mucus plug that's been closing up the entrance to the womb, keeping baby and the amniotic sac and all the pregnancy safe, begins to come away as your body prepares for labor. So the discharge is normal in pregnancy. It's a bit heavier than when you're not pregnant. It can get heavier as your pregnancy progresses. This is what you expect as a normal pattern in pregnancy. Now, I just want us to have a look at pregnancy discharge. I've got this really good graphic from Life with Gremlins. I'm just going to share it. Let's just check. Like I said, it's a new software. I'm not sure how this is going to work, so I'd love to hear from you about it. Let me know if you can see this properly. Yeah. Okay. Oh, hi, David. Thanks for joining. Let me know if there are any issues on the stream. Please. So yeah, just give me a shout if there's any problem. The volume's not good or the picture's not good. So hopefully you can see what I've got on the screen beside me. See, can I make it any better? Let's have a look. Let's see. Nope, not that one. I don't know if that's made any better. Let's see. Let's stick with this one. Okay, so at least you can see the whole picture. So this just looks a little bit about at the color and consistency of the different discharges that can happen, or the different types of vaginal discharge that you could develop when you're pregnant. And it gives you a bit of a scale from one color to the next. So you're going from white to all the way at the end where you have sort of dark brown, pinky, grayish colors. And then in terms of the consistency, how it feels, where you have thin fluid like discharge, milky, then snot-like, and then chunky. That's quite fairly good. I think that's quite a good description. So in normal discharge, when you're pregnant, we expect the color to be white or clear. Could be milky, slightly milky, off-white. It's thin, it's not heavy. It could be milky, slippery. That's normal. So if you're getting a discharge, let's have a look. So if you're getting a discharge that looks clear, milky, off-white, can be normal as long as there's no smell to it. If you're getting a discharge that's yellow, now that can be the color of old mucus that's exposed to air. So it might just be an effect of decomposition of a normal discharge. But if it's not smelly, you probably don't need to worry about it, but it's always good to have a chat with your doctor. If it is smelly and heavy, you must speak to your midwife or your doctor about the discharge so that it's clear what you're dealing with. Any other color outside of whitish, clear, milky, light, non-smelly, not heavy, anything else going on, please report to your doctor. Again, in terms of how it feels, thin, so it feels like water or like a thin gel solution. It's milky and slippery. All that is the character of a normal discharge. But if it's thick, like snot or catarrh, so that kind of consistency, or very chunky, like cheesy crumbles, or very heavy discharge, that's a clue. That's a clue that you should be speaking to your doctor, that something might be going wrong. And your doctor needs to have a look at that for you. So I thought that was a really good graphic. Let's just pull it out of this stream. So David says, yes, I can see the graphic. Fantastic. So that's going good. Let's continue. So is a smelly vaginal discharge in pregnancy abnormal? An unpleasant or smelly vaginal discharge when you're pregnant is not normal. I don't think I remember to say that. Well, I did actually. Every woman's vagina has its own odor, as long as it's not unpleasant. It's a personal sense, then that's fine. But when there's a smell that is offensive and it is not pleasant, that's a clue that something might be going, or something might be wrong, or might be untoward. It could be caused by infections, or it could be caused by poor personal hygiene. In terms of hygiene, not failing to wash regularly, or wear fresh clothing, particularly underwear, can cause unpleasant odors coming from the private area. So that's one quick way to solve that problem, if that's what's responsible. Now, some women could also develop what's called stress incontinence in pregnancy, and it's when they involuntarily, so they can't control it, leak urine. Because they're a very deep cough, or they sneeze, or they're laughing heavily, and they lose a few drops of urine from down below, from their private area. Now that could wet the underwear and cause smells to rise if they're not changed quickly, if you don't refresh yourself. So watch out for that. That can contribute towards something, a smelly under area that you might associate, or might you think, oh, my discharge is smelly. So just watch out for that as well. Another interesting point to note is, in pregnancy, some women are quite sensitive, and many women, when they're pregnant, actually have an increased sense of smell. So it might be that your scent hasn't really changed, it's the same, but your sense of smell is a lot higher, much better. So you're picking up this odor more acutely and thinking, oh, there's something wrong. Whichever the case, if you're concerned, if you think, oh, something is not right, speak to somebody, speak to your doctor, your midwife about it, and let us clarify. It's best to be on the safe side and clarify things before, and not assume that, well, okay, it's just me smelling things more acutely. So which of these discharges do we describe as smelly and abnormal? Let's just go through it again. I've said they could be thick, very heavy discharges. They could be like snot, the kind of slime that comes out of your nose, or like catarrh, when you're coughing and bringing up phlegm, that kind of thick. That is not normal. It could be bloody, or it could be reddy brown, so not exactly bloody, but just sort of looking brownish, or a darker color. It could be light pink. It could be dark yellow or green, dark green, or looking sort of murky, dull color of discharge. That's not normal again. It could also cause other sensations. What very commonly is when you experience itching, so very uncomfortable down below, or sore when you're passing urine. All these going on could suggest an infection or something going wrong within the your reproductive tract, within the womb and the vagina. Common infections that will fit into this category, I'm looking at particularly smelly and abnormal, smelly vaginal discharges. The first one is bacterial vaginosis, or also known as BV. So it's caused by this germ, and it's got a characteristic feature, which is that it causes a fairly heavy discharge that smells fishy, smells unpleasant, and some people say it's fishy odor. It's not sexually transmitted. We think it's commonly as a result of changes that can happen in the womb, in the acidity of your vagina, which can be caused by a lot of different things. Now, I do have a video in the channel about vaginal discharges that can happen due to infections, for example, with BV. So please take a look at that. That sort of goes into a lot more detail about that particular topic. So it could also be itchy, heavy discharge. There could be discomfort or burning when passing urine. So that's a type of infection that you could have. And it can also happen in pregnancy when the discharge becomes smelly and abnormal. The other infection is called Commonest. Now, that's the sexually transmitted infection. It also causes a very unpleasant odor. In fact, it's a lot more pungent than bacterial vaginosis. Heavy, very heavy discharge as well, and can be quite uncomfortable. These conditions both need to be treated. You need to speak to your doctor. If you do detect such symptoms, you need to speak to your doctor so that you can get the right treatment. Because don't forget, apart from the embarrassment or the discomfort of experiencing the discharge and you're pregnant, some of these germs causing these infections can travel up the vagina, up into the womb, and cause problems for the baby. So this is another reason why it's really important to pay particular attention to abnormal discharges. I want to touch on one of the commonest, outside of the normal vaginal discharge, the commonest abnormal vaginal discharge in pregnancy, which is thrush. Women popularly know it as thrush. This is discharge caused by the fungus Candida, and it leads to a vaginal discharge that you might describe as being off-white or cream in color, or cheese, like cottage cheese for those who eat cottage cheese, but it's quite thick, this discharge, in consistency, and it can cause very uncomfortable sensations down in your private area, very itchy, very sore tissues. It's usually not smelly, but I wanted to put it in here because it is one that many pregnant women might experience. It's not sexually transmitted, but it is quite common in pregnancy, easily treated most of the time with creams or tablets of particular antifungals, which if you discuss with your doctor, some of them can be purchased over the counter and can be used for mild symptoms. It is possible for it to come back during your pregnancy, so you might need treatment more than once. But the important thing is you can help to prevent developing it by wearing loose cotton underwear, regularly washing your private areas, having regular baths. And some women find it helpful to avoid perfumed soaps or bath products because sometimes that can affect the pH of your skin and the area and increase the growth of those fungi and make it easier for an infection to develop. So I also wanted to look at, before we round up here, smelly vaginal discharge after delivery. That's an important aspect. We've talked about what can happen during pregnancy. Infections could contribute to abnormal discharges. But what happens after delivery? Again, an unpleasant vaginal discharge after delivery is not normal. It could be caused by infections, depending on what your delivery experience has been. So, for example, if you've had a normal delivery and baby has been delivered vaginally, but you sustained a tear or you were given a cut and episiotomy, and if you want to learn more about that, we did a video on that just was it like or the week before. So make sure I'll put a link in the description box anyway, so you can link to that video if you're interested in knowing how that develops and how we deal with that. But if that was your experience during delivery, so there's a wound down there, or if you had a cesarean section, again, there's a wound on the abdomen. These are areas where you may, so watch out for that. You're more likely to have your low care, that is the discharge or the fluid that's coming out from the vagina after birth, you're more likely to have it looking bloody, heavier. If there's an infection within the womb or within the vagina that develops, or an infection that develops along the cuts or tear, the episiotomy that you sustained. Most often, if you have an infection of your cesarean section scar, it's a surface, it's an infection on top of the skin that you might notice. But if that's not dealt with quickly, of course, that could spread, not causing a vaginal discharge, but that could spread to the underlying skin. And so it's something that needs to be addressed quickly. So vaginal discharges can still happen. Abnormal discharges can still happen after you're pregnant. Watch out for very heavy bleeding, heavier discharge, pain in your abdomen as well. Those are signs that suggest that something might be going wrong. It can also be quite offensive. The normal look here, it tends to have a bloody smell, as you might associate with your period, but it's got a distinct smell, but it shouldn't be offensive. So when the game changes, when it starts to smell offensive, or you experience symptoms like it's heavier when it should be getting lighter, or you're experiencing pain as well with all that going on. So let's look at, I'll just quickly round up and make sure I've covered all the areas I wanted to talk about today. So let's quickly look at my summary page before I speak lastly about how to get rid of it. So we wanted to look at, what are the types of discharge you're expecting pregnancy? We've talked about that. Is having a smelly vaginal discharge in pregnancy normal? We've said, no, it's not normal. Look into it. Get it checked out. If you cannot immediately explain what's going on, so if it's not due to personal hygiene, get your midwife or doctor to have a chat with them. We've looked at what causes those discharges that are smelly and abnormal. So lastly, let's look at how we can get what we should be doing to rid ourselves of smelly vaginal discharge, whether during pregnancy or afterwards. The first thing is never, ever ignore it. It might infection during your pregnancy or after your pregnancy. So it's not something to ignore. Speak to your doctor or midwife about the symptoms as soon as you can. There's nothing about being embarrassed here, please, because the possible complications, like I've said, might include harm to baby and to yourself. So it's really important to get on board with your healthcare provider. It's next step is to get the right treatment. So that sort of goes out of your hands if it is an infectious cause, because it depends on your health provider to identify the infection and treat you properly. Like I said, some very mild cases of thrush where there's a bit of an itchy, slight discharge. If you've had it before and you're pretty certain what's going on, can be treated over the counter. If you haven't, if you're not sure, please seek medical attention. No point taking any risks. After pregnancy, if a discharge develops, it's important to treat quickly because if you don't, for example, if it's an infection of the wound or cuts or tears along your perineum, they may not heal properly if the infection is not treated. If it's an infection coming from within the womb, so coming from higher up inside the womb, or pelvic inflammatory disease, if it's not treated, it could lead to scarring in the tubes or within the womb, and that can lead to infertility as a complication. So these are some of the reasons why it's good to engage early and to get treatment as soon as possible. Just a quick bit about, remember to keep clean, regular baths while you're pregnant. Some women feel particularly hot and sweaty. The solution to that is just continue having fresh baths, get regular, wear fresh cotton underwear, cotton in particular. I didn't want to go into too much detail about bacterial vaginosis because I said there's a video that we have on the channel which I think explains it, but other types of material for underwear could irritate the skin and contribute towards discharge. I've talked about vaginal washes, how they could irritate the vaginal lining and cause inflammation, discharge, irritation, and so on and so forth. And keep yourself well rested. Eat well in your pregnancy and during the period after delivery. so that your tissues can heal, come back together, and with minimum amount of infection. So these are tips for how we can quickly get rid of smelly vaginal discharges. If you're not sure about anything, ask. Nobody's going to penalize you for asking questions. So guys, I hope this has been helpful. Thank you so much for watching. Thank you so much for everyone who's been part of the stream this afternoon. I wanted it to be a very quick one so that we don't spend too much time, because there are just a few points to raise here, but they are important. If you know anybody who you think would benefit from the points I've just shared, please don't forget to share the video with them. Give us a like on the in our different channels, whether you're on Facebook or on YouTube or whichever that you connect with us to watch this video. Okay, so I hope you have a wonderful week, and I hope to see you again. Check out our next video coming up on Thursday, and hope to see you again next week, Sunday. Let me know if you've got any questions that you'd love us to chat about on the stream. Look at the description box for links, and I'll see you again soon. Have a fabulous week. Bye.